Now I am going to talk about the edema condition due to the deep vein thrombosis or due to the thrombus, how the edema occurs. First of all, we should memorize our knowledge on Stalin forces. In the arterial lane, yes, Stalin forces had hydrostatic pressure, capillary hydrostatic pressure, and also interstitial fluid hydrostatic pressure. I recommend you to watch my previous video on Stalin forces and you will have a better understanding about this edema condition. And the second force is capillary colloid oncotic pressure and interstitial colloid oncotic pressure. And also same happen in the venous end. Also it has a hydrostatic pressure both in capillary and interstitial fluid, and also it has colloid oncotic pressure both in interstitial fluid and yes, of course, in the capillaries. Okay, now in the arterial lane, we have to find the net value or net filtration. There are two downward forces and two upward forces. What we do is we sum these two, correct these two forces, downward forces and upward forces, and minus these forces, and we find the net value. Net value is there are two downward and upward, and the net value is into the downward 11 millimeter of mercury. I am not going to add any values or anything. This is the value we get. Okay, now move on to the next side. We can have on the venous end, there are two also downward forces, PC and PF, and we collect these forces and we minus two upward forces, PF and phi C, and we get a negative. There's a downward and upward, and we get the upward force. Okay, this force is 9 millimeter of mercury. I am not going to add the values or anything, just to recall your memory. This is what happened in the Stalin forces. You already know this. See, in the arterial end, there is a filtration, no? In the venous end, what happened? There is a, reabsorption occur. Okay, arterial end, there is a filtration. Arterial end, there is a filtration or downward net pressure or downward net force. But in the venous end, there is a net upward force. Okay, this is what happened. This is the reabsorption. Reabsorption. Now what happened in a deep vein thrombosis? I will explain you. Think this is the vein, normal vein. Okay, no problem. But this is a vein with a thrombus. Thrombus mean a blood clot, no? Blood clot. There is a blood clot obstructing this venous vein. Blood clot, there is a blood clot obstruct the venous vein. Then what happened? There's a normal blood flow in there. This is normal vessel, but in this abnormal vein or there's a thrombus in this vein. Therefore, blood do not flow. Therefore, this blood accumulated within this vein. Blood accumulated this vein, and what happened? In this part of the vein, the blood volume rises. But there is no any blood volume rises. There is a normal blood volume. Then what happened? Remember the force, the hydrostatic pressure. I explained that the hydrostatic pressure occur due to what? Due to these particles, due to these blood particles clashes with the wall. These blood particle clashes with the wall and it creates a pressure. It is termed as hydrostatic pressure. Then what happened? There's a the normal value, there's a normal blood flow, but there's a higher volume of blood. It means higher the volume, the higher the particles in the blood. Therefore, more particle clashes with the wall. More particle clashes with the wall. But there, in a normal vessel, there are less amount of particle clashes with the wall. Less amount of particle clashes with the wall. Therefore, this has PC, this has PC, but in this, the damaged vessel or the thrombus vessel, the PC value is more larger or much larger, because there are more particles due to the obstruction of this thrombus. The more blood accumulates in the vein, and the particles within the vessel increases. Blood particles within the vessel increases, and it increases the PC value or hydrostatic pressure. Now let's move on to our calculation. What happened? This PC value rises. PC value rises mean downward forces. What happened? This net downward forces, the value of this net downward forces rises. As a result, reabsorption level, what happened to the reabsorption? It reduces. Reabsorption level reduces. As a result, less reabsorption occur. Then what happened? This is the venous end, this is your venous end. Reabsorption reduces. Reabsorption reduces mean more fluid accumulated in interstitial fluid, interstitial space, or interstitial fluid rises, or more fluid accumulate in this interstitium. We know more fluid or excess fluid accumulated in interstitium causes edema. This is what happened in deep vein thrombosis. This is how deep vein thrombosis occur. Okay, in the venous end there are net pressure. In the reabsorption is the net results. And what happened? Blood clot obstruction in the vein, and the particles or blood particles within the obstructed vessel rises. As a result, PC value rises. As a result, net reabsorption reduces, and excess fluid accumulates in interstitial fluid, resulting edema. And if you like this my video, and subscribe and like, and your support is must to us.